168 would be not 64. It should be somewhere here. Hmm. रोशनी की तरफ देखिएगा, आँख हिलाइएगा नहीं. So if you find that your incision is getting short from any one side, see, for example, I'll show you this example. If you see, this is little more proximal and this is little more distal. Now this difference is arising because when we started, this knife was tilted like this. So if you tilt it, the which is lifted side will be having a shorter length, and the dipped side will have a longer length. So when you find that your incision is not symmetrical, you can adjust your knife tilt likewise. It's a pretty hard cataract. He has been waiting too long. You will usually find that when you inject this dye, patients start having this eye movements more. The reason become being that the media becomes absolutely opaque. So they will have that urge to look at the light, they start searching for it. Very good staining. And today I'll show you what is burst mode. I can see your urge to irrigate, but don't do it now. Now, staining makes your job so easy. One very good index is that you place the capsule, which is a turn on the capsule itself, and then you can have an outline of where you have to proceed. So the turn part will become your guide. Now we don't usually need hydro in mature cataracts because there's already cortex separated. So I'm never very aggressive with this. इसको हार्ड में लगाइए, मोड चेंज करिए. Dr. Hard. It's a code word. People may wonder who is Dr. Hard. Now burst mode is when you have 0.1 second of 100% power delivered. And for a hard cataract, it gives you a very good purchase. So you can chop through. These are deep AC, so I'll have to go vertically down. You aspirate your overlying cortex as usual and see if you can rotate it now. Even if you can't, doesn't matter. And always put one pulse just like what I did. It will have those bubbles inside. See that?
Yes.
Now because I know that how thick I have to go, I can take that chance. Even I will give one more pulse. And then you approximate your two tools. You will find that even in a hard cataract you get a wonderful primary chop. Now once you have this full thickness chop, it makes your surgery so very easy. You can rotate, you have more leverage, and now you know the depth where you have to go. Pre-placing your chopper gives you some more edge because then you are forcing your piece into the tip, and so you have better purchase. And now because you can see the thickness you are traveling into, so you are more confident that you are not going through and through. Make sure that you are separating the posterior fibers because if you don't separate them, you'll always have a trouble. In cornea, but this time we'll have pulse mode. This is what I have programmed it for. Now we have orbit cool. So now we can switch off our burst mode, because now we can bury little more posterior, so that we don't have to have that much purchase needed, because you are then burying it in a deeper plane. And you keep on chopping. Don't worry about those pieces which you have already chopped. You'll consume them later on. If you lose grip, then you reapply some power so that you again get a grip, because if you don't have a grip, it will not chop, it will rotate. Now we are all free with pieces which are separated. You simply put your probe in the center, go ahead, grab one piece, pull it to center, and you consume it. Now this shows me that probably our tube is not choked. See, the thing is moving. So for that you apply some power for a while, and then it should free itself. Because the narrowest part, narrowest part of the tip is power बढ़ा दीजिए. Narrowest part of the tubing is the tip. 50. Cornea dry मत होने दीजिएगा. Because this we are using too much power. Cornea irrigation, especially the incision side. There is a heat being generated. So if you want to avoid a wound burn, you need to apply your irrigation. See, increasing the power now increases our efficiency, that pieces are emulsified faster. And this will also reduce the incidence of your tube choking. Bus. Now I'm using very less power because it is set to linear, so I can control that. Just a little bit of power. IOL खुलवाइए. लेंस खोल दीजिए. Mature cataracts will usually have very minimal cortex. See that this is a wound burn. रोशनी में देखिए, इधर उधर मत हिलाइए आँख. Wound burn has an impact on astigmatism, also on wound sealability. So, but this amount of wound burn should not matter to us. I don't know, however, how much effect it will have on astigmatism. Only time will tell that. The song choice is very poor. It's a popular song, bhaiya. The song choice is very poor. Have some popular songs. Either we are exploring new music, or else we are getting entertained. The song choice is very poor. Hey, the top 100 लगाओ. अमेज़न तो खुद ही बता देता है। मोस्ट प्लेड, वही जो नॉइज इंचार्ज, फेको नॉइज इंचार्ज। जो मांगेंगे वही नहीं मिलेगा, ये इंचार्ज की खासियत है। वही अच्छा इंचार्ज भी है। तुम डिस्क्रिमिनेशन कर रहे हो, तुम पे डिस्क्रिमिनेशन का आरोप लगेगा। लेबर रूम में क्या लगना चाहिए? लेबर रूम में कौन सा लगना चाहिए? हाँ खिलाइए, नहीं सामने देखिए रोशनी। रोशनी में देखते रहिए। दोनों आंख बंद करें।